Welcome back, everyone. Families can be under a lot of stress right now. In an effort to keep families strong during this difficult time, we have Dr. Renee Renardi with us with some helpful resources. Thank you so much for joining us.
Yes, happy to be here. Thank you.
Now, we just talked to Fargo Police. This is an important topic, but sometimes a difficult conversation to have. April is Child Abuse Prevention Month. And our new normal has everything kind of turned upside down right now in everyone's lives. Can we talk first a little bit about maybe just ensuring that children are safe during this time?
This is such an important topic right now. Many states are finding reductions in their child abuse reporting. And while that sounds like great news, it's quite the opposite. And when children are not under the watchful eye of communities, they're at high risk for child abuse and neglect. And so with it being Child Abuse and Neglect Awareness Month, this is a really, really important time to talk about these scary statistics that we oftentimes see. Somewhere between 4 and 7 children die every single day in the United States due to neglect and abuse. Many of those children are under the age of 3. So it's really important for people to understand that abuse and neglect are never okay. So if you're a child experiencing these things, it's really important to reach out to somebody and to get help for this. If you're a parent that's struggling with a lot of stress right now and you're noticing that you're having a really hard time controlling your anger, suffering from drug abuse or alcohol abuse, or a family where there's domestic violence, it's really important to understand that these are risk factors and there is help available to help break these cycles within your family.
Can you expand on that? Because I feel like this is a stressful time, and sometimes parents are feeling that they're losing their tempers more, but they don't feel like there's somewhere safe for them to reach out for help. They don't want to lose their children. They don't want to be judged, but somewhere in the back of their heads, they know that they do need some help. So where do they go?
It's really important. There are a lot of different resources available. A lot of times people like hotlines. I reached out to a hotline. The name of the hotline is Child Help National Crisis Abuse Hotline. Their toll-free number is 1-800-4A-CHILD or 1-800-422-4453. And that's a resource for parents if you're struggling. And the majority of children who experience abuse and neglect, it is from a caregiver or a parent. So if you're taking care of a child and you know things are not okay with you and you're afraid of reaching out, you can call anonymously to a hotline like this, and they will be able to give you some guidance and help you find local resources. The goal of Child Protective Services is not to remove a child from a home. They want to keep families together, but that has to be in a safe situation. And so it's important to look at what we need for families to make that situation more safe for the parents, for the children, and as a family unit.
When we started this conversation, you mentioned, everybody's at home. There's no school. We're not seeing families and kids like we used to. We're also hearing, though, and we don't always think about kids being involved, that domestic issues are on the rise because of the stressful, lives that we're living right now. That also includes children, right? I mean, you have to think that that involves the whole family unit, not just a husband and wife when we're talking about domestic abuse increasing during these times.
Domestic abuse, any type of violence within a household is a risk factor for the adults in the household and for children in the household. So it's really important to understand that any type of violence against somebody, an adult or a child, is not acceptable. And so nobody should accept that behavior. If you're a victim of abuse, please reach out to somebody. Call 911. Call a text line. 741-741 is a text, an emergency text line. I actually tried it to make sure that it worked. They respond immediately. You may get something that'll pop up that says, your cell phone may be charged. Go for it. All right. Make that report. Make yourself safe if you're a child or if you're a victim, an adult victim of abuse in your household. These are really stressful times for people. As school is out, people have more responsibility of their children. That's another risk factor. When parents feel like they're not able to meet their children's needs, when they're not meeting their own needs, when there's so many stressors, this is kind of a perfect storm for domestic violence and child abuse. And so it's important for people to understand that it doesn't make you a horrible person. There are resources out there for you. Please contact local social services, contact a hotline, contact your child's pediatrician or your doctor, contact a mental health provider. Many of us, I know myself, I'm doing all telehealth now during the COVID-19, but there's so many resources still available to you. Don't be afraid to reach out.
And before you go, too, one more time, it would be nice just to break down some of the other signs or symptoms, because it's not always a bruise that you see.
Right. It's not always obvious. Children who act over-responsible for their age might be an indicator of child neglect. If they're taking care of all of their children, other children in the house, or on the opposite side, where a 9-year-old is acting very infantile. If children are very avoidant or seem unattached to their caregiver, that can be a sign. Children who are wearing clothing that isn't appropriate for the season. So when it's warm outside, they're wearing long sleeve shirts. Children who seem oversensitive, or their behaviors in general just tend to be over the top. So overly fearful, overly withdrawn, things like that can be signs that there may be child abuse or neglect. Children who are missing out on the current arrangements that schools have. Now, for some families, they don't have access to those resources, but that also is a risk factor if other adults don't have eyes on children. So please be on the lookout. If you're a teacher, if you're a doctor, and you know an at-risk family, try to take an extra effort to check in on them. If you're a neighbor, if you're a family member, and you know you have a family member struggling with substance abuse or they have a history of violence, please check in on them. If you have any concerns, you can make an anonymous report to Child Protective Services. You don't have to give your information, okay? When there's any doubt, make the report. So it's really important that children are protected during this time.
Dr. Renee Renardi, thank you so much for joining us today. A very important conversation to have all the time, but especially this month, as April is Child Abuse Awareness Month. Thank you so much for your time today.
Thank you.
Stay with us. Coming up here on North Dakota Today, we're talking about virtual entertainment to make pandemic life a little less stressful.